IMA in Trivandrum, and we have Mr. G. Madhavan Nair, who is the CEO of Enrich Biomedical Technologies, with us to talk about sustainable reconstructuring of hospitals and spaces related to medical healthcare. Could you give us a little bit of your background? How did you get involved in this?
Basically, I'm a scientist. I'm a biomedical scientist, and I was designing healthcare devices pertaining to open heart surgery, then respiratory medicine. And I used to visit hospitals in Delhi and Bombay, and regularly visiting operation theaters. And I have a lot of friends, cardiac surgeons and thoracic surgeons. So they all used to tell me about the pathetic condition of the hospital and how bad it is for a visitor, normal visitor, because it stinks like a hospital and it looks like a glorified jail. You see, then the first project breakthrough I got was with Dr. Naresh Trihan, where when he started the hospital Escort Heart Center. So I had a chance to interact with him because he came straight from United States, and so because of my US background, he also liked me, and we could decipher a lot of ideas there. And then I started working with certain other hospitals, and so I just see that it was very difficult because the entire hospital scenario in India is overshadowed by architects. If you have a lot of money, you just approach an architect. We want to make a hospital, so they will visit a couple of hospitals and then they make a design. And most of them are designed like a hotels. Any
what
hospital.
What are the key factors that go into the planning in a hospital?
There are a lot of things. There are a lot of things there. You look at any hospital, any patient room, it will look like a typical hotel room. Toilet in the front, you have patient behind. But that is not the way, because the problem is then the smell or the exhaust system doesn't work properly through a shaft. So you have to have a proper layout plan for the hospital. Then the patient rooms has to be away from the main laboratory or treatment area.
Is that for infection control?
Yes, it's all for infection control. And mainly I talked about the smell. The smell can be completely avoided if you have proper air handling system with activated carbon filters, so that the smell is totally avoided. And then the very look of the building inside, either it is ceramic tiles, either it is blue color painted or green color painted. You look at the ceiling, they are either white or you have plaster of Paris ceiling. That's what, and you can also find fungus, because the plaster of Paris is not at all recommended in healthcare facility. Any service leak from air conditioning system, it creates dampness and fungus will start coming in. So I wanted to change the scenario to bring in more life to the system. I want to make hospital more green and lean by saving energy. So you can have larger windows, you can have bring better sunlight inside, then have very good ventilation system with proper filters.
So you would say that all these, especially ventilation, is very poor.
Very poor. Yeah. Even if you go to,
which is very ironic, because
yes,
good ventilation would actually help you recover from.
Yes, recover. Not only that, it also transmits disease to the normal people. So you go to any of the leading hospitals in the city, the lobby is not at all. You feel suffocated. You feel there is something lacking, because it's oxygen. Oxygen is lacking there. It is air conditioned. You have a comfort, but something is lacking because it is inadequate air conditioning, inadequate fresh air inlet. That's why. Because if you want to have more fresh air, more energy, so they compromise on this. They recycle.
In your experience now that you've been working with with this industry,
yeah.
How responsive are the hospitals?
They're all responsive, because I've done renovation of at least about more than 100 hospitals in Kerala, and everybody is responsive. And because you are having a strategic location and you have built up a business over years, if you want to demolish and then make a new hospital, it's going to cost a lot of money, and you also come in with a lot of legal problems. Whereas if you do the internal part, nicely modified to the modern standard, you save a lot of money, because you can do by part. So their business is continued. That is why.
It seems like a lot of the hospitals, even when they upgrade, there's only I don't know whether they are really embodying the philosophy that you're talking about. about.
No, no.
So how far are you able to take
No,
that in a
because
hospital?
what I am doing, see, it's a question of self-marketing maybe, because I don't do much, self-marketing. But I got a lot of orders, a lot of customers from throughout Kerala and Karnataka.
So when a hospital usually upgrades here, do they just technically upgrade, or is it?
No.
Well, are they really
The
changing?
visuals,
For example,
yes.
are they changing the ventilation system?
Yes, they also change the ventilation system, because if most of my clients, fortunately, they listen to me. And even I work with certain architects, they also listen to me. They say, yes, what you say is correct. This theater has to be so big. So, because what they do, they make adequate space. The basic fundamental principle of an architect is save space. But here it's not like that. You should be able to augment the treatment or add more equipment. So you need space. You cannot have minimum space. So a theater has to be minimum 500 to 600 square feet. Most of the hospitals are 350. So you have constraint. Everything is crowded. So that itself is very bad. So, and then the ambience, bringing light inside, providing sky pictures in the critical areas. I provide.
Can you tell us about that? What is
Yeah,
the
because
advantage
advantage is the healing environment. The nature is the best cure. So if you have a blank ceiling, or if you have a beautiful ceiling with the blue sky and a lot of flowers, and when the patient is rolled down, he feels very happy about it. And with the very light controlled LED lights, I've done many hospitals. Everybody in CT room, in MRI room, in hospital, airlocks. All those places are very vulnerable.
This kind of information, where do you source it from?
I travel globally and attend many conferences on hospital design, and so I get ideas from them.
What is your recent?
Only thing is, it is definitely cost effective if you make it in India.
Okay, so contrary to what people might think,
yes,
in the long run, it's actually cost effective.
Yes, yeah, definitely, yes.
How about copper surfaces on?
Pardon?
Copper surfaces on public spaces.
Copper.
Because copper is supposed to. This is just an aside. Copper is supposed to cut down the rate of infection by at least 97%. Is what they say.
It's not practical in a hospital. Why? Because a hospital is a place where it is subjected to continuous disinfectant. Cleaning is a process. So you have high level of alkali, then acid, then nascent chlorine, everything. And copper is a very light material which can be, eroded fast. So it is not a solution at all, definitely. But silver is definitely yes. And now there is a technology called nano, titanium dioxide is being used as a material which can absorb smell. It can also take care of infections like bacteria, then staphylococci, then a lot of things can be fungi can be prevented to great extent. Yeah. So this is and a lot of innovations are happening worldwide, but we are not somehow we are not keeping at pace with it. That's why.
What would your advice be to hospitals to keep up?
Definitely keep a pace and visit. They may visit other, but problem is when a normal doctor, when they visit United States, they can't get into John Hopkins because it's very all security areas. But if it is possible, you should actually meet with their technical team or engineers and see what has gone behind the wall. And what thinking has been gone behind the wall, like the children's hospital in California. It looks like a Noah's Ark. Children are so happy to go there, but you take children to our hospital and they start crying right from the day, from the entrance, because the smell is that actually, make them scared.
So change the hospital experience.
Yes, that's what the hospital should never look like a typical house. It should look like your own home. That's the new theory in even labor rooms. It's actually a labor suit where you can create like your own bedroom, and then it can be converted into a theater. Technologies are available.
Do you think Kerala will change adequately?
Changing, and a lot of people, even the remote villages, they are also acceptable for change. Like I said, keep the same location and upgrade. Costs a lot of money. Okay, thank you very much.